In its worst recorded year, this institution admitted 412 patients. That same year, it buried 506. For more than a decade, at Larkspur State Asylum, more people died inside its walls than were ever formally treated and released. And for nearly 70 years, almost nobody outside a handful of state archives ever knew the actual numbers. This is the true story of how that happened and why it took until 2017 for anyone to finally add it all up. Before we go further, if stories like this one matter to you, the kind that get buried under decades of paperwork until almost nobody remembers them, stick around, because the actual death toll at Larkspur didn't stop where you'd expect it to. And if your own family has a connection to a place like this, I'd love to hear about it in the comments below. Larkspur State Asylum opened in 1887 in a low, marshy stretch of land in the eastern part of its state, chosen, according to the original siting committee's own report, primarily because the land was cheap and largely unwanted for farming, a decision that would prove, over the following decades, to have consequences nobody on that committee could have anticipated. The institution opened with a designed capacity of 340 patients in a single Kirkbride-style main building, meant to embody the era's genuine, if ultimately overwhelmed, optimism about what humane institutional care could accomplish. For its first decade, Larkspur functioned roughly as intended. Surviving annual reports from the 1890s describe a population hovering close to its designed capacity, a relatively stable medical staff, and discharge rates that, while modest by modern standards, at least suggest an institution that was, in some meaningful sense, treating and releasing a portion of the people committed to its care. The first sign of trouble appears in the 1901 annual report, which notes, almost as an aside, that the institution's population had crossed 500 patients for the first time, 50% over capacity, and that the medical staff had not been correspondingly increased. That single administrative failure to scale staffing alongside population would define the next 6 decades of Larkspur's history, and it's the root cause of the number that gives this story its title. By 1910, the population had reached 890. By 1925, it exceeded 1,400. The marshy, poorly drained land the original siting committee had chosen for its cheapness turned out to have a second, far more dangerous property. It was, by every subsequent public health assessment, an unusually favorable breeding ground for the mosquito populations responsible for malaria, and later, for the kind of waterborne bacterial illness that thrives in poor sanitation conditions, conditions that an overcrowded, understaffed institution built on marshland was, almost by design, poorly equipped to prevent. The first major recorded outbreak came in the summer of 1913, when a combination of malaria and what the surviving medical logs describe only as intestinal fever, likely typhoid, based on the symptoms described, though the institution's own diagnostic capacity at the time couldn't confirm this with certainty, swept through the main building's overcrowded wards. The institution's own mortality log for that single summer records 131 deaths in a population that, by the most recent prior count, stood at just over 1,000 patients, 13% of the entire institution's population, gone in a matter of months. It would be easy to assume that a death toll this severe would have triggered immediate state intervention. It did not. The state inspector's report, filed later that same year, acknowledges the outbreak in a single paragraph, attributes it to unfavorable seasonal conditions, and recommends, as its primary corrective action, improved drainage around the main building, a recommendation that, according to subsequent inspection reports, was only partially implemented over the following decade, due to what those same reports repeatedly cite as insufficient appropriated funds. This pattern, outbreak, minimal acknowledgement, inadequate correction, repeat, would define Larkspur's institutional life for the next 4 decades. The second major outbreak came in 1922, when a waterborne bacterial illness, this one more conclusively diagnosed as dysentery, given improvements in the institution's own diagnostic capacity by that point, killed 204 patients over a roughly 5-month period. The 1922 outbreak is particularly well documented because it triggered, for the first time in the institution's history, a formal state legislative inquiry, though that inquiry's own final report, filed in 1923, concluded only that further study of the institution's water supply and sanitation infrastructure is warranted, without allocating any specific funding to conduct that study, a conclusion that researchers examining this period have since described as functionally equivalent to no action at all. By the time we reach the institution's documented worst single year, 1931, the year referenced at the start of this video, when 412 patients were admitted and 506 died, Larkspur's population had reached its all-time peak of just over 2,100 patients, housed in a complex that, even after several decades of piecemeal expansion, had a designed capacity less than half that number. The medical staff that year, according to the institution's own payroll records, numbered 11 physicians and 43 nurses for a population exceeding 2,000, a ratio that made anything resembling individualized medical care a structural impossibility, regardless of any individual staff member's competence or dedication. It's worth pausing here, before we go further into the numbers, to talk about one of the people who actually lived through this period, because the statistics, as overwhelming as they are, can obscure the individual human reality underneath them. A young nurse named Florence Idell began working at Larkspur in 1929, just 2 years before the institution's worst recorded year, and remained on staff for the next 33 years, retiring in 1962, the year before the state finally began a serious, sustained effort to reduce the institution's chronic overcrowding. Idell gave an extended interview in 1994, 2 years before her death, to a graduate researcher studying institutional mortality during this period, an interview that survives today as one of the most detailed first-hand accounts of what it actually meant to work inside an institution where death, in her own words, was simply part of the daily routine in a way that I don't think anyone outside those walls could have understood. Idell described the 1931 outbreak specifically, having lived through it in her second year on staff, in terms that researchers have since cited as among the most harrowing surviving descriptions of conditions at any American asylum during this period. "We didn't have enough beds for the sick, let alone the dying," she said, in a passage from the interview later published in an academic study of institutional mortality. "There were days that summer when the orderlies were carrying bodies out faster than the kitchen could prepare meals for the patients still living. I want to be honest with you, I do not believe anyone at that institution, myself included, fully processed what we were living through while we were living through it. You simply could not stop to feel it and also keep working, and the work never stopped." The cause of the 1931 crisis, when researchers finally reconstructed it, decades later, using surviving medical logs, weather records, and Idell's own testimony, turned out to be a combination of factors stacking on top of each other in a way that, individually, the institution might have survived, but that together proved catastrophic. A particularly severe summer heat wave strained the already inadequate water and sanitation infrastructure. A simultaneous outbreak of what appears, based on symptom descriptions in the surviving medical logs, to have been a severe strain of influenza swept through wards already weakened by malnutrition, the institution's food budget, like its staffing budget, having failed to scale with its population for decades, and the institution's chronic overcrowding meant that any infectious illness, once introduced, spread through densely packed wards with almost no capacity for the kind of isolation that might have contained it. I want to give you a specific number here, because I think it matters more than the aggregate statistics already mentioned. Of the 506 deaths recorded at Larkspur in 1931, researchers cross-referencing the surviving mortality log against the institution's intake records were able to determine that at least 118 of those patients had been admitted to the institution within the preceding 12 months, meaning that for at least 118 families, a relative committed to Larkspur for psychiatric care died of an entirely unrelated infectious illness within a single year of arriving. This is the part of Larkspur's history that, when researchers finally compiled it in full in 2017, generated the most significant public attention the institution had received in decades, because the aggregate number, once properly calculated across the institution's full 71 years of operation, was almost impossible to comprehend. The 2017 study, conducted by a state university research team, working from the institution's surviving mortality logs, intake records, and the partial state inspection reports that survive across Larkspur's operational history, calculated a total documented death count from the institution's 1887 opening through its eventual 1958 closure of 11,426 patients, against a total documented discharge count, meaning patients who were formally treated and released back into the community. More patients died at Larkspur than were ever successfully treated and released. That is the number this video's title refers to, and it is, according to the 2017 study's own authors, one of only a small handful of documented cases among comparable American institutions where this specific, stark comparison holds true across an institution's entire operational history, rather than during one particularly bad period. It would be a mistake, though, to present this purely as a story of unrelenting tragedy with no human resistance to it, because that wouldn't be accurate to what the surviving record actually shows. A physician named Dr. Marcus Wexler joined Larkspur's staff in 1934, 3 years after the institution's worst recorded year, and spent the next 2 decades, until his retirement in 1954, engaged in what his surviving correspondence describes as a sustained, often frustrating campaign to force the state to properly fund the institution's sanitation and staffing needs. Wexler's annual reports to the State Board, considerably more direct in their language than his predecessors' reports had typically been, repeatedly and explicitly connect the institution's mortality rates to its underfunding, in language that, reading it now, stands out sharply against the more euphemistic, administratively cautious reporting that had characterized the institution's earlier decades. Wexler's 1938 report includes a passage that the 2017 study's authors specifically highlighted as remarkable for its directness. I am compelled to state plainly what previous reports from this institution have, I believe, danced around for too long. Patients are dying at this facility, in significant numbers, from conditions that are substantially preventable given adequate resources. The state's continued failure to provide those resources represents, in my professional judgment, a policy choice with a body count, and I would ask the board to reckon with that fact directly, rather than continuing to characterize these deaths as unfortunate but unavoidable. Before we move further into how the institution eventually changed, I want to tell you about one specific patient whose case Wexler himself documented in unusual detail, because her file, more than almost any other surviving record from this period, illustrates exactly what was at stake in his campaign for reform. A woman named Beatrice Holm was admitted to Larkspur in 1935, at the age of 22, committed following what her intake record describes as a severe postpartum breakdown after the loss of her infant daughter during childbirth, a diagnosis that, by modern clinical understanding, likely represented a serious but treatable episode of postpartum depression and grief, rather than the kind of chronic condition that, in 1935, was assumed to justify indefinite institutionalization. Beatrice's case stands out in the surviving record because Wexler, newly arrived at the institution and already pushing for the kind of individualized attention the overcrowded facility rarely allowed, personally took on her care, a decision he documented explicitly, in his own clinical notes, as something close to an experiment in what proper treatment, given adequate resources, might actually accomplish even within Larkspur's constrained circumstances. Wexler's notes on Beatrice's case, preserved in unusually complete form, document a course of treatment focused on what he termed restorative routine and genuine human attention. regular, dedicated time with medical staff, protection from the institution's worst overcrowded conditions, and what his notes describe as a deliberate effort to treat her as a grieving young woman in genuine crisis rather than as a permanent psychiatric case. Beatrice Holm was discharged from Larkspur in 1937 after just under 2 years of treatment, into the custody of her husband, and went on, according to a brief follow-up note Wexler added to her file in 1940, to have 2 more children and what he described as a full recovery by every measure available to me. Wexler cited her case repeatedly in his subsequent reports to the State Board as evidence of what the institution could accomplish if given the staffing and resources to treat patients individually, rather than processing them in the overwhelmed, impersonal manner that the institution's chronic overcrowding otherwise demanded. Mrs. Holm did not need to spend the remainder of her natural life within these walls, Wexler wrote in a 1941 report. She needed attention, time, and basic human dignity, all of which this institution is capable of providing, to perhaps 1 patient in 20, given our current resources, when by rights we ought to be capable of providing it to every single person committed to our care. Wexler's advocacy, sustained over 2 decades, did produce measurable results, even if those results came slowly and incompletely. Though it's important to note that progress at Larkspur was never simply a straight line of improvement. The Second World War, beginning in 1941, created an entirely new crisis for the institution, one that Wexler's own reports document with the same direct, unsparing language he'd used to describe the 1931 catastrophe a decade earlier. As the war drew increasing numbers of able-bodied men, including a significant portion of Larkspur's already inadequate orderly and maintenance staff, into military service, the institution found itself facing a staffing collapse layered on top of its pre-existing chronic understaffing. Wexler's 1943 report to the State Board documents a working orderly staff reduced, at its lowest point that year, to barely 1/3 of its already inadequate pre-war numbers, forcing the institution to rely increasingly on the patient labor system that had long been part of its operations, but now expanded to cover essential tasks, including, according to Wexler's own uncomfortable acknowledgement in that report, basic nursing and sanitation duties that should never have been the responsibility of patients. This wartime staffing crisis produced a smaller but still significant secondary mortality spike, documented in the institution's own records as occurring primarily in the winter of 1943 into 1944, when an outbreak of pneumonia, spreading through wards that Wexler's reports describe as critically understaffed, even by Larkspur's already low standards, killed an additional 167 patients over a 4-month period, a death toll that, while far smaller than the 1931 catastrophe, nonetheless represented, according to Wexler's own analysis filed with the State Board afterward, a direct and foreseeable consequence of asking an already overextended institution to operate with 1/3 of its necessary staff, a consequence I predicted in writing to this board in March of 1942, 18 months before these deaths began. Wexler's willingness to put that prediction in writing, and to later cite it directly when the crisis he'd warned of materialized, is itself part of why researchers studying Larkspur's history have come to view him as a uniquely significant figure in the institution's story, not because he single-handedly solved problems that were, in truth, far beyond any one physician's ability to solve alone, but because his sustained, documented insistence on naming the institution's failures plainly, year after year, created exactly the kind of paper trail that made the 2017 reconstruction of Larkspur's full mortality history possible in the first place. Without Wexler's 2 decades of direct, uncomfortable reporting, researchers studying this institution would have had to rely far more heavily on the kind of euphemistic, administratively cautious language that characterized so much of Larkspur's earlier documentation, language that, as we've seen throughout this story, tended to obscure exactly the kind of systemic failure Wexler insisted on naming directly. The arrival of penicillin and other antibiotics in the years immediately following the war's end, combined with gradual post-war increases in state funding and staffing, finally brought Larkspur's mortality rate down to levels that, while still far from acceptable by any modern standard, represented genuine, lasting improvement rather than the temporary respites that had followed earlier periods of reform pressure. Larkspur's annual mortality rate, which had peaked during the 1931 crisis at roughly 24% of the institution's total population in a single year, had declined, by the early 1950s, to closer to 4% annually. Still far higher than would be considered acceptable by any modern standard, but a meaningful, hard-won improvement that researchers attribute substantially to Wexler's sustained pressure, alongside broader nationwide improvements in sanitation infrastructure. Florence Idel, in her 1994 interview, specifically credited Wexler's tenure as a turning point in her own experience of working at the institution. "Things were never good, not by any reasonable measure," she said. "But after Dr. Wexler came, and especially after the war, when the new medicines started reaching us, I do believe we started actually saving people more often than we were losing them. It took far too long to get there, but we did get there, eventually, and I think that matters, even against everything that came before it." Larkspur's population began a sustained decline through the 1950s, tracking the same broader deinstitutionalization movement that, as we've discussed in other stories on this channel, reshaped American mental health care across this entire period. The institution finally closed in 1958, its remaining patients, a population that had fallen to just under 600 by that point, down from its 1931 peak of over 2,100, transferred to newer, smaller regional facilities across the state. What happened to Larkspur's physical buildings after 1958 follows a familiar pattern for institutions of this scale. Partial demolition through the 1960s and 1970s as the state gradually sold off portions of the property, with the main administrative building and two of the original residential wards surviving, in deteriorating condition, into the present day, now fenced and largely inaccessible, similar to several of the other abandoned institutions we've covered. What sets Larkspur apart from most of those other stories isn't really the physical remains, though. It's the burial ground. Larkspur's institutional cemetery, established in the 1890s on a section of land roughly a quarter-mile from the main complex, was, by necessity, one of the largest institutional burial grounds of its kind in the country, simply because the institution's mortality rate, sustained across 7 decades, required it. A 2019 ground-penetrating survey, conducted as a follow-up to the 2017 mortality study, identified just over 9,000 probable individual grave sites across the cemetery's full acreage, a number that, cross-referenced against the surviving burial ledger, accounts for the overwhelming majority of the 11,426 documented deaths, with the remaining gap attributed, by the survey's own authors, to a combination of family-claimed remains buried elsewhere. I wanted to see this place for myself, so this past autumn, I made the drive out to the property, where a small state historical commission now maintains limited public access to the cemetery grounds specifically, even though the institutional buildings themselves remain closed to visitors. We're standing now at the edge of what's left of Larkspur's cemetery, and I have to tell you, nothing I read in preparing for this video really prepared me for what it's like to stand here in person. This isn't a cemetery in the way most of us picture one. There's no real pathway system, no orderly rows of individual headstones. What you mostly see, stretching out across this entire field, are small numbered metal markers, most of them low to the ground, many of them tilted or partially sunken after more than a century, each one representing a single person, a single life, a single name that, in the overwhelming majority of cases, is recorded only as a number now, cross-referenced to a ledger that researchers are still, even today, working to fully connect back to individual identities. The Historical Commission has put up a single interpretive sign near the cemetery's entrance, with a brief summary of the institution's history and the 2017 mortality study's headline numbers. But standing here, looking out at 9,000 markers stretching toward the tree line, the number on that sign, 11,426, stops being an abstraction in a way it simply can't be when you're just reading it. Each one of these was somebody. Each one of these had people somewhere who loved them, who in many cases spent years, sometimes decades, wondering what had actually happened to them after they were committed to a place like this. I'll leave you with this. Florence Idell, in the same 1994 interview we've drawn from throughout this video, was asked, near its end, what she most wanted people to understand about her 33 years at Larkspur, if they were ever going to hear her story at all. Her answer, I think, is the right note to close on. I want them to know we tried, she said. Not all of us, not all the time, and certainly not enough, given what happened. But there were people inside those walls, doctors, nurses, orderlies, who saw what was happening and fought, in whatever small ways were available to us, to make it better. It took far too long. Too many people died who shouldn't have. But I would not want anyone watching this, decades from now, to think that nobody on the inside ever cared. We cared. We simply weren't given what we needed, for far too long, to make that caring count for as much as it should have. Thanks so much for watching. If this story moved you, stick around. There are more forgotten places like this one, scattered across the country, and I'd be glad to have you along as we find the next one.